Diabetes Connections is brought to you by Inhaled Insulin. Fast in, fast out fits your lifestyle. By Omnipod 5, the only tubeless pump that integrates with Dexcom G6. By Dexcom G7, the #1 recommended CGM brand. And by Edgepark. Simplify your diabetes journey with Edgepark.
This is Diabetes Connections with Stacey Sims.
This week, living with type 1 diabetes while living with an insulin allergy. How on earth is that possible? Well, it's what Kate Lecker is going through. And experts are still trying to figure out a solution.
I really thought that, if they found the solution, that they could do a case study. And again, it could help other people. And that really was, helped to keep me more positive. But at the end of the day, I can tell you, it is incredibly terrifying to have something that no one knows what to do with.
Kate shares this very scary situation, how she's coping. She's lived with type 1 for decades. She also has a daughter with type 1, and what might happen next. This podcast is not intended as medical advice. If you have those kinds of questions, please contact your healthcare provider. Welcome to another week of the show. I am always so glad to have you here. You know we aim to educate and inspire about diabetes with a focus on people who use insulin. Important topic this week, but before we get to it, just really quickly, huge thank you for the wonderful feedback we got. I announced the 4 cities for 2024's Mom's Night Out events. They are Charlotte, Chicago, Denver, and Philadelphia. So if you're hearing that for the first time, please head on over to diabetes-connections.com. Click on the Mom's Night Out tab. All of the information is there. Registration is only open for Charlotte, but you can sign up for alerts and announcements for all of the other cities. Please share that information. We are trying to reach as many moms as possible in these cities. All right, the subject at hand this week is frankly pretty scary. I've only done one episode before on an insulin allergy that was with a young man many years ago. There are others who developed this condition. You'll hear Kate talk more about that. Bottom line is she's really hoping for some answers here, hoping that you may listen to this interview, share it, and maybe someone who knows something new might come across it. Long shot, but you never know. So Kate Lecker was diagnosed with type 1 when she was 3 years old. She has been using insulin for 40 years. She started having severe allergic reactions. She was in the hospital for more than 40 days. I really appreciate how open and honest she is, and we had a great talk, and you'll hear my conversation with Kate Lecker right after this. Support for Diabetes Connections comes from Omnipod 5. And I'm amazed at how hard these automated insulin delivery systems work. Omnipod 5 automatically increases, decreases, or pauses insulin delivery every 5 minutes. This technology is called Smart Adjust, and it's in the pod. So that means if you're out on the football field and the controller is in your bag, the pod and Dexcom G6 continue to talk and make adjustments. That would have been awesome for us in middle school, or when Benny was backstage at the school play, all of that. And you get the freedom of no tubes. Fill out the quick online form. See if you're eligible for a free trial. Go to diabetes-connections.com and click on the Omnipod logo for full safety risk information and free trial terms and conditions. Also visit omnipod.com/diabetesconnections. Kate, welcome. Thank you so much for talking to me. Your story is almost unbelievable. I can't wait to hear more. Thanks for spending some time with us.
Thank you. I appreciate you reaching out.
Before we get started, I know that you have a bit of a disclaimer. I'd like to just give you the floor. Let's go ahead and do that.
Yes. So I am an employee of Xeris Pharmaceuticals, but what I'm talking about today is not representing Xeris, their opinions. It really is just my opinions, my experiences, and my life as it is as of today. So I just wanted to put that disclaimer out there.
Yeah, well, I appreciate that. And, thanks for being so straightforward about everything. We're really familiar around here with disclosures, and we definitely appreciate that. But man, this is not a story that you hear often, if at all. Can you talk a little bit about what happened? When did you figure out that you had an allergy to insulin?
It was a very slow unearthing of what it actually was because it is so rare that it wasn't a straightforward, it wasn't an anaphylactic reaction. That's called a level 1 hypersensitivity. So that's not what it was. That would have been easier to identify and address. Mine was more of a couple of months of just decreased insulin sensitivity or major insulin resistance, where I kept having to change my settings in my pump because the normal amount of insulin that would correct a blood sugar or cover carbohydrates just wasn't working anymore. So I reached out to my endo. He said, well, this happens, you're older, you've had a couple kids, your parents are type 2. So sometimes metabolically, you can kind of look more like a type 2. So it all seemed to make sense. But, looking back on the events leading up to the hospitalization, it was just building and building that I kept having to take more insulin. And I thought, I went through process of elimination. I thought maybe the welts and the huge hard nodules all over my body from my pump infusion sites, maybe I was allergic to the material the cannula was made of. So it was a process of elimination over a couple of months, but it all ended with I stopped using the pump. I went to injections. I even went to old school regular insulin because they said that has a lot less additives in it that would cause issues. So try regular. This is going to be the answer for you. And I injected it and ended up my whole arm completely swelled up. And I had to call my endo and say, I'm scared this is seriously going to lead to a breathing issue. This is not working. And he said, I don't know what to do for you. And that was very scary. I find him a very intelligent man. I've gone to him for years, as do a lot of my colleagues in the diabetes field. So when he said that was pretty terrifying. He didn't know what to do. He said, I think the only place that will know what to do would be Johns Hopkins. And luckily, I live about an hour away. So I jumped in the car and went to Hopkins for what I thought would be a couple of days in the hospital.
Wow. But
Obviously, it turned out a little bit differently.
Yeah. And before we get into that part, if I could just ask you a little bit more about the reactions, because I know, a lot of listeners over the years have had skin reactions, as you said, to the cannula or to the adhesives. Not to get too detailed here. I don't want to make you relive everything. But was it obvious right away that was not what was happening?
No, it wasn't, because I'll openly admit I was on a pump for about 25 years. And as you're on a pump, maybe you don't change it exactly at 72 hours. I'm sure some of the listeners can feel that way too, that, it's not convenient to change it right now. So I'll change it tonight. I'll change it tomorrow morning. So I was wearing my infusion set probably 4 days and it was only meant to be worn 3. So I thought, it's something I'm doing. Maybe I'm causing scar tissue. Maybe it's poor, pump hygiene. So I just kept trying different things, but I was getting these huge welts under my skin where my infusion set was, where as soon as I would give the insulin, it would just burn, like it would sting, like I've never experienced before. So that was kind of the first sign that something's not quite right. But again, I was using so much more insulin. I thought, well, now maybe this does make sense. So I kept kind of explaining things away as far as the skin reactions went. But I would remove my infusion set and have like a golf ball size welt sticking out of my stomach. The area was red and itching and super painful, where I thought, no, this doesn't look like I wore my set too long. It wasn't infected. So I knew that wasn't it. So that was really the localized skin reaction. So again, I didn't have hives. I didn't have trouble breathing. I didn't have any of that. Mine was just insulin resistance and the localized it's called cell-mediated response in wherever my infusion set is, and now wherever I inject insulin.
Wow. And as you said, you'd been on a pump for a very long time. You were diagnosed as a little kid, right?
I was little. Yes. It was in the 80s, early 80s.
I'm sure you don't remember. You were a toddler, but do you remember anything about that old school type of diabetes management when you were a kid?
Yes. And no offense to anybody who practiced back then. I want to be very careful how I phrase this, but it was not great. We'll say that. So the insulins that they had were Lente, Ultra Lente, NPH. They peaked. You really had to eat based on the medication you took. If you didn't, you would have a really adverse outcome, a really bad outcome. And I was really lucky to get on an insulin pump. I believe I was the first patient in all of Kaiser Permanente to get a pump.
Yeah.
So it was a big deal back then. I know now it's like, oh, you're diagnosed. Let's talk about technology. But back then, people didn't do that. And it seems so foreign now, but it really was injections. And I had a lot of lows, and I had, I would go unconscious a fair amount because that's just unfortunately the nature of the medications back then.
What year did you remember what year you got the pump and how old you were?
I got the pump when I was, it was in high school. So I think I was 17 or 18.
It's just funny to think like you're the first person in this whole system, there's this big system to get an insulin pump. You're a teenager. It's not, it's such a different time.
Yes.
What pump was it?
Yeah. So it was a Desatronic H-Tron Plus.
Yep.
Why I remember that, I don't know, because I can't remember.
You'll never forget it.
But so it's, looking back at pump therapy, it was just all it did was deliver a basal and boluses, and now they're just so advanced. But yes, that was the one I was on. I was super thankful for it. But again, it was very expensive. And I know that the insurance companies, of course, still look at what's the benefit. versus the cost. And unfortunately, it does cost a lot, but it really does change your life. So
Wow.
very thankful I had that opportunity.
So fast forward now, you're at Johns Hopkins and they admit you. Tell us what happened there.
Yes.
Because that wasn't the end of it.
No, it was not. So when I presented to Hopkins, my blood sugar was only in the 200s. That's where it had been living for days. I was doing inhaled insulin, Afrezza. I was injecting in different areas. I was injecting very small amounts to see if I could absorb it better in teeny doses. So I was kind of limping along, if you will, working out twice a day, eating keto, doing whatever I could to stay out of DKA. So when I presented to Hopkins, again, I was not in DKA. I was blood sugar, I think, was like 238 when I went to the triage nurse. But unfortunately, that's not an emergency. So, I'm texting my endo saying, I've been sitting here 4 hours, 6 hours. I was like, I'm going to go into DKA. I have not had insulin now in like 20 hours. I can feel I'm getting really sick. Please do something. So he thankfully called and got a hold of an ER attending. And then they came out and brought me back. But it's such a bizarre thing to say. I'm an insulin dependent person with diabetes and I'm allergic to insulin. Yeah. So it was people actually chuckled. It was, I'm here because I'm allergic to insulin. They were like, oh, I hope you're not insulin dependent. Ha ha. And I'm like, nope, but I am. And that stinks.
Oh my gosh.
So, it was just because it's so unheard of, I guess. And I did get that response from so many people of, oh my gosh, I didn't know this could happen. But apparently it can. And I'm proof of that. But, I'd sat in the ER. They were trying to figure out what to do with me. They decided to immediately admit me to figure out what to do. But it was a challenge because nobody really wanted to start me on insulin because they were afraid I was going to have an anaphylactic reaction. So unfortunately, sitting in the ER, waiting to go up to the room, they said, as soon as we get upstairs, they're going to start your insulin drip. And I went into DKA. So I felt pretty bad by the time I got up to the unit. Mm-hmm. And thankfully, I got some IV insulin. So that's how I remained for the following 7 weeks at Hopkins. So that was, I was thankful for the insulin, but yeah.
Sorry to interrupt. So dumb question. What's the difference between IV insulin and Humalog, Novalog, the insulin that people with diabetes use every day? Yeah.
Well, the IV insulin is regular insulin, but as I had said earlier, I injected that and had a massive reaction to it. So the difference is my body apparently can handle it IV. It just cannot handle it in my cells of my skin. Okay. So I had a couple of IVs that kind of blew outside of the vein. And within minutes, my whole arm swelled up and it was super painful because IV then went subcutaneous, meaning it got out of the vein and got into my skin and my whole arm swelled up. So it was very clear that I could take IV insulin, but I couldn't take sub-Q insulin. But generally patients don't walk around every day on IV insulin. Right, so that's what kept me there because that was the only thing I could do. And I kept saying, I have so many pumps at home. Can I try to rig something up? Come on, someone's got to be here who's creative engineering wise and let's figure out a solution. But unfortunately I stayed there because no one could figure out, what to do to get my body to calm down to be able to handle injections or a pump infusion site.
So you were living at the hospital. I mean, I assume you felt okay,
yes.
Except for being really scared. What was that like?
And I said it was, I've tried to figure out words to put it into. It's very hard to, because, being in the hospital for a couple of days is hard enough, especially when you have young kids, you have a career, family, but being there 7 weeks, it was very difficult. I'm a pretty strong person. I'm pretty, emotionally stable, but I can tell you there were very bad days, very bad times because I just said, I can't stay here. I have a family, I have a life, I have a career. I can't stay here. And they were just really focused on how to, medically manage me. And it was very hard. It felt oftentimes like they didn't really see me as a human being with a life. They saw me kind of as a test subject or kind of a case study. That was the hardest part, was living there and being perfectly fine. If I was ill, if I needed medication to feel better or it was sedated, then obviously I'd be okay being in the hospital, but I was perfectly fine. Mentally, physically intact. I was just on what I called my life support, which was my IV insulin.
And I imagine too that with a teaching hospital like that, did everybody stop by your room because it's such an unusual case? And did that get annoying?
Yes. Yeah, it's people did stop in and just, would kind of scratch their head and say, wow, everybody's talking about you. I was like, well, that's good, I guess. Hopefully someone comes up with a solution versus, hey, did you hear about the girl in ICU? Right. So
oh, boy.
It was okay. I mean, I'm a nurse. I had to go through nursing school, and observe and try things on patients. And, everybody goes through that as far as medicine goes. So I was open to, hey, can I see your stomach? Can I see your injection sites? Can I, so I did become pretty much on display, but I was actually okay with it. I was really hopeful at that point when they found a way to get me out that they could actually write a case study that would really solve this issue for other people moving forward. So I tried to focus on that versus being like a circus animal that people coming in to touch and look at and take pictures of. But that's kind of how I framed it to myself, at least.
So you're obviously not talking to me from the hospital. What was, and I hesitate to use the word solution because I do know that
Sure.
this is not a cure situation, but what happened? Support for this episode comes from Afrezza, and when it comes right down to it, there hasn't been a lot of innovation for insulin. Sure, there are different brands, but nothing really unique when it comes to insulin delivery, except for Afrezza. Afrezza is unique because it is the only ultra-rapid-acting inhaled insulin available. It starts working quickly without the need for injections at mealtime. Once you breathe Afrezza into your lungs using the inhaler, insulin appears in your bloodstream in less than 1 minute, and it may start reducing blood sugar in about 12 minutes. Find out more, see if Afrezza is right for you. Go to diabetes-connections.com and click on the Afrezza logo. Afrezza can cause serious side effects, including sudden lung problems and low potassium. It is not for patients with chronic lung disease such as asthma or COPD or for patients allergic to insulin. Tell your doctor if you ever smoked, ever had kidney or liver problems, a history of lung cancer, or if you're pregnant or breastfeeding. Most common side effects are low blood sugar, cough, and sore throat. Severe low blood sugar can be fatal. Do not replace long-acting insulin with Afrezza. Afrezza is not for use to treat diabetic ketoacidosis. Please see full prescribing information, including boxed warning, medication guide, and instructions for use at afrezza.com/safety.
There was very little movement, and they had tried the typical treatment plan is called desensitization. So if you were allergic to a certain type of insulin, obviously you can switch to another one and see if that works. If it doesn't, then you could go to an allergist. And what they did in the ICU for me was inject teeny tiny amounts of insulin, like 1/100th of a unit of insulin. And if you don't react to that, then they increase it to kind of get your body to get used to it. But unfortunately, all of their desensitizations failed. So I had all of these spots all over my body that they had been injecting over hours and days to try to get me to not react. But unfortunately, I kept reacting. So they had to scratch that plan. And they had really put a lot of hope in that plan. So there really wasn't a plan B. Yeah. So, I sat in the ICU and just, basically sat there while everybody was, people way smarter than me were sitting around conference tables saying, maybe we could try this. Let's try this. No, that won't work. My concern is this. And so there was a lot of behind the scenes happening, but honestly, I just sat there. And so they had a change of shift. And like you said, it's a teaching hospital and all the residents were brand new at that time. So I would have different people coming in. I did get, his name is Dr. Alvarez. He signed on to my case. He wanted to come meet me the night before because again, he had heard about me. He wanted to introduce himself, which was really nice because he was one of the first people that had actually come in to introduce himself and really, I don't know, treat me like a human, I guess. So he came in to introduce himself and he said, I have a plan. He said, I've already heard about you. I've been, thinking about what to do. Here's my plan. And it was just very exciting to hear a plan. So the plan for him was to basically kill my immune system so that my body wouldn't fight the injections anymore. So that's in essence what he did. So they inserted a central line, a very large IV in my chest, and they basically cleaned my blood. So they took all of my blood out and took out all the plasma, which is where the antibodies live. So the first thing was to get rid of the antibodies that had built up because they were so incredibly high that no matter what they injected, I would react. So they had to get all the antibodies out of my blood. So that's called plasmapheresis is the fancy term. So they did the plasmapheresis over a couple of sessions, over a couple of days. In essence, they cleaned out my blood, got rid of all the plasma. And then at that point, they gave me an immunosuppressant, a series of immunosuppressants, one called IVIG, the next one called rituximab. I also took methotrexate, and they started me on Cellcept. So all of those are immunosuppressants. I'm sure that there was some calculation of what to give me in what order and dose. But basically, it calmed my immune system down enough that they were able to start injecting very small units of insulin, and I didn't have a reaction. So as soon as they tested out how many injections I would have to take and the small doses, so right now I can take up to 20 units of insulin. in an injection. So if I need more than that, I just have to take multiple injections. So that is in essence how they got me out of the hospital.
I have so many questions, Kate. Well, let me start with this one. That sounds so scary. You were very upbeat. You sound terrific. But when you're saying, well, they had to kill my immune system. I know you feel like you probably had no choice, right? What else are you going to do? But do you remember? I mean, what was that like?
Terrifying.
Yeah.
I can tell you it's not even just terrifying as far as the procedures that had to be done, the biopsies, so many IVs because the insulin was irritating my veins. They would constantly blow. It's just the amount of pain that I endured, and procedures is one thing. The other thing is it's just terrifying to know that you're going to go through all of this pain and all this time and it may not work.
Yeah.
And then you're back to square one. I really thought that, if they found the solution, that they could do a case study. And again, it could help other people. And that really was, helped to keep me more positive. But at the end of the day, I can tell you, it is incredibly terrifying to have something that no one knows what to do with. And it's more of, let's throw a bunch of stuff against the wall and see what sticks. And I mean, thank God they did that because I'm out of the hospital, but it is very scary. A lot of times when you have something even rare, they can say, well, I don't really treat this, but I know someone who does.
Right.
And they'll refer you to someone. With this, it's more of, well, I keep seeing all my doctors and they know what's going on and my blood sugars are terrible. And they're like, Kate, I'm sorry, I don't know how to help you. That part continues to be pretty challenging. But yes, it was scary to sit in that hospital bed knowing I didn't have an option. I had to say yes. Of course, they didn't tell me I had to say yes. I did the informed consent, but I don't want to, say it's something about Hopkins, but it really felt I didn't have an option. I had been there 7 weeks.
Yeah.
So at that point, I was willing to do whatever they told me, which they said, when you go home, you may be on 10 to 20 shots a day. Is that okay? And I said, yes, it is.
Yeah.
As long as I can go home. So that's pretty much where we are now.
Are you on 10 to 20 shots a day?
Yes. Depends on the day, but yes, I still can't tolerate large amounts of insulin. I do get welts still all over my body. So I give the smaller injections, but they also just did another round of the big immunosuppressants. So again, there's no protocol to go off of. These immunosuppressants are not meant for this. So that's the other really challenging side is insurance, because everything is listed as experimental because none of these medications are approved for a level 3 cell mediated insulin hypersensitivity. So, anytime they request anything, it gets denied. And they're like, nope, this is experimental. It's not on label for this. You can't do this. And they have to appeal it, which again, I appreciate that they do, but it just adds another layer of complexity to it when I text my doctor saying, hey, my blood sugars are a mess. I can't get my blood sugars below 250. I feel awful. Can we look at changing the immunosuppressants? He's like, no problem. Let's get you another infusion. And, then you just, cross your fingers and pray the insurance says yes.
Again, knowing the disclaimer you gave at the beginning, I don't know exactly how much you can talk about this, but,
sure.
Xeris Pharmaceuticals makes the Gvoke HypoPen, which is used to treat emergency lows. So where does that factor into this story, your use of that?
Yeah, it factors in that there are days when the immunosuppressant isn't effectively lowering my immune system, my body ramps up a defense system to the insulin where I can inject. There are many days, usually I inject about 80 to 90 units a day. When I'm really resistant and the immunosuppressant isn't as effective as it needs to be, I can inject 300 to 400 a day.
Oh, wow.
And I still can't get below 200. So that being said, where the Gvoke comes in is that all of a sudden, and I'm sure there's something that's happening to trigger it, but to me, it's like a light switch goes off and all of my insulin says, oh, hey, let's work. And those hundreds of units I gave to try to stay out of DKA, they activate and my blood sugar plummets into the 20s and 30s more rapidly than I've ever seen a blood sugar drop. Wow. So I have to keep Gvoke with me. I now have one in my overnight bag, my purse. I have a little diabetes bag. I have 2 of them with me because it just drops so quickly and it's a runaway train. And there's no amount of Sprite or orange juice or glucose tablets I can eat to effectively manage that. And it becomes a big safety concern, especially because I travel for work. I'm on trains and planes and in hotels driving. It becomes a big safety issue. So I am incredibly thankful to have that tool in my bag to be able to use, which again, I'm probably definitely using it more often than most people would, but it's been a lifesaver for me versus just trying to drink or consume all the sugar that I need to fix that blood sugar of 29.
Wow. I found your story when you shared it publicly on LinkedIn, and I'm sure you shared it elsewhere, but that's where I saw it. And I cannot imagine the amount of advice. I'm sure you got a lot of good wishes and support. I cannot imagine the the well-meaning but nonsense cures and things that have kind of come into your mailbox. Has there been anything that was helpful?
Yeah, there definitely was. So, I'm a very analytical, detail-oriented person. So as soon as I posted it on LinkedIn, and let me just say, for me to do that, I'm not very open in public about any of my medical issues and, my struggles. I don't want to be seen as a victim or a mess, whatever you want to say. So it was very hard to make that post to begin with. But people who saw it thought, holy cow, Kate must really be in trouble if she's putting it out here asking for help. But it was a call for help, and just to repost it, to try to get in front of as many people as possible in hopes that someone would say, oh, I have a patient I've treated with this, or I know someone who has this. Let me give you their doctor's name. And that's exactly what happened. So I made a spreadsheet of one sheet was doctors or medical providers. Another one was medications. Another one was tests. Another one was studies. I just kept this huge spreadsheet. So I added a lot of really good information, and I did get the methotrexate, the rituximab, the Cellcept. People were actually giving me that information. And thank goodness my amazing doctor, Dr. Alvarez, was open to me giving him the spreadsheet and saying, hey, I updated the spreadsheet. Here it is. Because he said he may not have the answer. And it was just so nice to have someone that was willing to look at kind of crowdsourcing information, because he knew he may not have the answer. So that was phenomenal. But I did get a lot of great contacts. I have applied to all of the clinical trials that people sent to me. Unfortunately, I don't qualify for them, but I'm going to keep trying. But yeah, I'm still getting contacts from it. I still get a lot of messages from my original post.
Wow. I talked to a family back in 2017 with a 9-year-old who was diagnosed with an insulin allergy. I'm curious, have you found other families, or have you connected with anybody else?
Yes, I have. There's actually an insulin hypersensitivity, I don't want to say support group, because I'm sure that's not the right thing to say, but I'm trying to look it up right now. It's a group that actually does deal with this. And generally they're looking at younger kids, because obviously, when you think type 1, you oftentimes think kids, but obviously us kids grow into adults with type 1. But it was really nice. I did get a couple of contacts from the people from the organization, and they were incredibly kind, gave me their phone numbers. They're happy to discuss their case or their kid's case with me. And I'm still in contact with them, which is amazing, because it was really nice to hear, what medications did they use, what to stay away from, what are the lookouts. And I can say, though, that a lot of the people that I talked to, the end treatment for this is a pancreas transplant. And, I understand that may be what I end up doing, but I'm really not ready to accept that right now. I'm really hoping to get an islet cell study, or, to find a medication that does work, that doesn't have the awful side effects or cause even more issues. That's what I'm hoping, but it really does seem that that's where most people end up.
I was going to ask you about the pancreas transplant, because that's the first thing that came to my mind, but it's certainly something you want to avoid if you can. I mean, that's another thing altogether. You mentioned, you have kids, and you have a daughter with type 1.
Yeah, I do.
How is she doing with all of this? I mean, that's got to be, I don't know. I don't want to put words in your mouth. I think about that, how tough that would be.
Yeah, one of the first concerns of my type 1 daughter was, is this going to happen to me? And I told her very resounding no, because it is just so rare. I can't imagine this will happen to you. But genetically, unfortunately, she is my child. So I do have to worry about that. I definitely squashed her fears, but it definitely is a concern for me. As far as being in the hospital for that long, luckily, again, I only live about an hour away from Hopkins. So my kids were able to come and visit a lot, but it definitely caused some lasting challenges with them, as far as, they'll come down in the middle of the night just to make sure I'm here, to make sure I haven't gone anywhere. Or even when I have to go get my infusions or go to doctor's appointments, they get really concerned that I'm not going to come home. And, I can't, with kids, we like to promise them something's not going to happen. We like to make promises and keep them for our kids, but I can't make that promise. And I know I can't. And I've explained that to them, that I will do everything I can to not have to go away for extended periods, but I can't promise I won't have to go to the hospital again. So it definitely had a lot of lasting impact, especially on my littlest one. She's 9, Malin. She definitely still has issues sleeping. And anytime I travel for work, she gets really upset that I'm not coming home, which was never an issue. I've traveled since before either of them was born.
That is just so tough. And my heart goes out to you all. What happens next? I mean, as you said, you've signed up for clinical trials. You got your spreadsheet. You're doing a lot. And in that question, I also should have asked, when did all of this start? Because I didn't start with that. Like, when did this start for you?
I really tried to think back because, again, especially at Hopkins, they wanted to do a root cause analysis and see, did I have COVID? Was it when I got a vaccination? And I didn't have anything like that. And I wasn't able to give them like a specific date. But when I really have thought about it over the last couple of months, I really did start to have issues in May. And I just started to notice welts. But again, I thought it was more of a behavioral thing. Maybe I wasn't being as compliant as I should. It started back in May as far as the severe insulin resistance and the random blood sugar drops. I was working as medical staff at a diabetes camp for kids, and I had this massive low that I didn't know where it came from. And I couldn't explain it. And thank God, again, I had Gvoke because I had to take it. And I was really shocked by that because I was very well controlled before all of this. So it was a couple of months coming on. It started with the insulin resistance is really where I started noticing things. And then again, it started with the itching, the welts, the pain at the infusion sites. So it was a couple of months coming on.
Yeah. And when did you get out of the hospital?
August 28th.
Okay.
Not that I was counting the days, but August 28th at about 12 noon, my husband picked me up and took me home. So yeah, it was a turning point when I had the medicine staff. Dr. Meredith came in and said, we need you to really start thinking about your time here in terms of weeks and not days, because I was really hoping that each time they did something, it would work and I would just be home in a couple of days. And they said, we have a feeling you're going to be here a few more weeks. And that was at about week 4. So, it definitely changed my frame of mind because I was really holding my breath every day that something would work. And it wasn't. It was very mentally challenging. That's for sure.
I'm sure. I know you have a way to go. As I said, there's no resolution here, unfortunately. Are you happy you shared your story? Are you glad you made those posts?
I am. I definitely, again, I got some helpful information for myself, but also I've just been able to kind of do some education with people because, again, many people, including myself, I didn't know this was a thing. And, there's a whole group. So insulin allergy and hypersensitivity awareness, you can Google them, but it's all about, what they've gone through, medications that worked for them, what the end treatment plan was. But it's been very nice. I've heard from people and they've said, hey, I actually had these same issues. And I have actually referred people, especially on the East Coast or in the Baltimore area, to my immunologist. So he's, tongue in cheek, he jokes with me, hey, thanks, Kate. I appreciate it. He's got so many patients now that are coming to him. But I think it's the silver lining that I may, every day, as I said, jokingly, is a new adventure. But if I can help somebody else even identify that this is happening versus, oh, something weird is happening. Oh, my blood sugars are high and, seemingly random things because nothing was a red flag. If I can help somebody else, that to me is a silver lining. And that's what I really try to focus on. It's just the long term of what this is going to be. I don't really know. It really does change, but I'm looking at, Europe has an implanted pump. I'm looking at that. I'm looking at islet cell transplants. Those are the studies I'm trying to get into. But again, with my unique, I think is a better way to put it, with my unique condition, I don't know that I wouldn't attack the islet cells. I really have no idea. So if anybody is listening, if you have any ideas, please feel free to search me out. Or if you have a fantastic healthcare provider that really, is kind of Dr. House or Grey's Anatomy type, I would love to come and see them. I don't care where they're located because other than that, it's a challenge that nobody really knows how to help me. So that's pretty much it.
And I'll be happy to connect. If anybody is listening, you can definitely reach out to me and I'll get in touch with Kate. Thank you so much for sharing this story. I wish that we were able to wrap it up here at the end by saying, and then she's fine in the end. But I do appreciate you coming on and talking so openly about it. And, we're all thinking about you. Thank you so much, Kate.
Thank you. I appreciate it.
You're listening to Diabetes Connections with Stacey Sims.
As we said, she is looking for any answers she can find. Now, I know you are not the kind of audience that is going to send her snake oil, things like that, but send it to me and, send whatever suggestions you've got or doctors you may know or connections you might want to make. Send those to me, Stacey at diabetes-connections.com, and I can send them along to Kate. I did want to mention, I asked her about Afrezza during the interview, and as I listened back during the editing process, I realized I didn't really follow up. And my question was, wouldn't that really solve everything for her if she could just use inhalable insulin? I did reach back out to her, and she said that the doctors really don't want her to take too much of Afrezza. And she's talking hundreds of units here is what she would need because they fear she might develop an allergy to those large doses. So right now, she doesn't have a reaction to it, a bad reaction. It does work, she says, so she does use it, but she doesn't use it a lot, and she can't use it in the dose that she would need for the very high and consistent blood glucose that she says she would have. So it kind of works, kind of doesn't, but it can't be the only thing that she uses. I will definitely keep you posted. Man, I mean, my heart goes out to her, and I just appreciate her being so open and so hopeful, frankly. So thanks a lot, Kate. All right, more to come in just a moment. I want to talk about the end of this year and the beginning of next right after this. Diabetes Connections brought to you by Dexcom. Diabetes doesn't always have to interrupt your day. Dexcom G7, a continuous glucose monitoring system, sends your glucose numbers to your phone or receiver. Know where you are and where you're headed without finger sticks and without interruptions. Dexcom G7 is the most accurate CGM, and it's covered by Medicare. Learn more, go to diabetes-connections.com and click on the Dexcom logo. Taking a look at the calendar for just a quick moment. 2024 is really busy already, which I find really exciting. I love traveling. I love meeting you all. And I've created some of my own calendar chaos, but we will get through this. End of January, I have a podcasting conference in Orlando. I'm speaking at the She Podcast Conference at the end of January, so that'll be a lot of fun. February 2nd and 3rd is Mom's Night Out Charlotte. I don't have to go far for that. I am the keynote with Carrie Sparling at JDRF Greater New England. That is in March. That is in Boston. I'm going to go to Friends for Life Falls Church. That's in Virginia. That's the first weekend in April. That's a really fun regional Friends for Life conference. Haven't been there since before COVID. But, Benny, my son, goes to school right near there. So I'm going to go check it out, visit him, and say hi to my Fiffles, my Friends for Life. And then later in April, it's Mom's Night Out Chicago. And we are just waiting for the exact date for some venue confirmations to announce that. So the first half of the year is getting off really busy. I have a whole list of the events I'm planning to be at for the entire year over at diabetes-connections.com. Click on community. Love to see you at some of these. And if you'd like me to come speak at your group, I also have added now a list of the talks that I do. Happy to create one for your group if you prefer. We can always jump on Zoom and do something virtual as well if that works better for you. I don't have a big wrap up or anything to say about 2023. I kind of suspect that I'll be back with something before New Year's. But just in case, to reflect a little, this has been a year of milestones, as we knew it would be in my family. My daughter graduated from college. My son graduated from high school. My family had 2 big reunions. We had my husband's family here. We had a big reunion here in May. We went to a reunion on my side of the family for Thanksgiving. It was just wonderful and kind of overwhelming and looking ahead to a new empty nest stage of my own life. And I'm really grateful that I get to do this and share it all with you. Lots more to come. All right. Thank you to my editor, John Buchanan from Audio Editing Solutions. Thank you so much for listening, for being here, for being such a great, smart, and wonderful community. I'm Stacey Sims. I'll see you back here soon. Until then, a happy, healthy holiday. And be kind to yourself.
Diabetes Connections is a production of Stacey Sims Media. All rights reserved, all wrongs avenged.
Life is busy and managing diabetes is a daily commitment. Edgepark can help you say goodbye to the worry of managing your diabetes supplies with a variety of cutting-edge insulin delivery systems from brands like Medtronic and Tandem. Plus, Edgepark accepts most insurance plans and handles the paperwork, so you can simplify your life, your diabetes care, and your budget in just one click. Go to diabetes-connections.com and click on the Edgepark logo.